All right, good morning, everyone. All right, I'm so happy to see all of your very bright faces here with us this morning for our mission members meeting. Let me especially acknowledge Jane Chernellik, our board chair. There's Brenda Rasher as well, who is the bishop's delegate, and you'll be hearing from her a little later today. We have with us some board members as well and other committee members of Mount Carmel Guild. There's Terry Alexa, who is our vice chair of our board. There's also Ellie Ingebrigtsen, who is also with us. Give a quick wave, Ellie. There's Kathy Moore. There is, put your hand. She doesn't want. All right. And other members of staff who are here this morning. I'm so happy to see you all. But more importantly, the purpose of this gathering is really for us to take a deep dive on this very important issue surrounding food insecurity. It is an issue that has persisted for a very long time, not just in New Jersey, but across the United States and indeed across the world. And the panel that you will hear from a little later this afternoon or this morning will be looking very closely at some of the issues surrounding food insecurity. But before we do that, I want to make the point that this gathering is an annual that Mount Carmel Guild assembles for what we call our mission members. Now, the organization is a membership organization, and so these are individuals who give sustainingly to the organization over many years. But we are also consistently open to finding new members, persons who are willing to contribute to our work, to give of their time, their talent, and their treasure. Now, the organization has been around for some 107 years, and it means that we have been really making an impact in the lives of so many people for so long. It was in 1920 that the then Bishop of Trenton, Bishop Thomas J. Walsh, bought the property at 73 and 79 North Clinton Avenue. It was one of those, still is, a large American Italianate building that was occupied by a very wealthy family who was into pottery. And during that time, the bishop felt that it was important for such an organization to be established that would respond to the needs of the most vulnerable. And since then, the organization has evolved over the years into what it is today. Initially, we were giving pre-packaged bags of food to individuals in need. And then we started to recognize, this was shortly after the pandemic, that it was important for us to look at an open choice model where individuals were now able to select what it is that they wanted rather than being given something that perhaps doesn't meet their dietary requirements or that they're just not interested in, right? And dignity is a big part of what it is that we focus on at Mount Carmel Guild. And coupled with that is our home health nursing program that provides compassionate care for individuals 60 years or older by way of medication monitoring. And I see our director of nursing walking in just as we're speaking about it. Give a quick wave, Corinne. Corinne Janoska is our director of nursing. You'll hear from her a little later in the program. And so with these two programs, these two pillars, the organization continues to provide the care that it does for residents in Trenton and across Mercer County. And so what we want to do today is to take a look at not only what we are doing at Mount Carmel Guild, which you will hear from in the various reports, but also to hear from our development partners, our community development partners. Many of you are in the room today. And it's important for us as collaborators to band together, understanding that the context within which we are operating today is not normal. And so there are a lot of other steps that we may have to take as partners in this ecosystem of care, as what I call it, to ensure that we can consistently meet the needs of the most vulnerable. Because as we know, when there are issues, whether it be on a global scale or on a local scale that affects questions of the economy, it is the poorest who feel it first and who feel it hardest. So we have to do the very best we can to meet these needs. And so Before we go any further, I'm going to invite now Brenda to come forward with prayer, and then we will transition into the remainder of the program. All right, thank you. Please make her welcome.
Good morning, and thank you so much. On behalf of Bishop O'Connell, who could not join us today, and on behalf of myself as Bishop Delegate, I've been the Bishop's Delegate to Mount Carmel Guild for over 8 years. And, we do have one. But I do want to thank you because the Mission Member Program, which I am honored to have been a part of beginning to really explore and develop, is just so important in order for us to do, as Darren has mentioned, to answer the call of Jesus, to give our time, talent, and treasure. And there's 2 ways to do that. One is to do it yourself, but you know you can't do it all. We can't. No one person can do it all. So by giving maybe your talent to a group of people, but also your treasure, enables more people to do what we are called to do. So I thank you so much for being here. And I'd like us to kind of calm our minds. There's a lot of noise outside in the world, so let's calm our minds and kind of open our hearts. And I do want to say, Darren and I did not coordinate the speech based on my prayer, but I think it fits. Heavenly Father, we come before you with hearts filled with a desire to serve and uplift our community through our being mission members from Mount Carmel Guild. You called us to love our neighbors as ourselves and to be instruments of your peace and compassion in the world. Grant us wisdom and discernment as we seek to serve others for you. Help us to see beyond outward appearances and to recognize the dignity and worth of every person we encounter through Mount Carmel Guild and in our everyday lives. Fill us with your Holy Spirit, empowering us to be your hands and feet in the world, bringing hope and healing wherever we go. We lift up our community into your loving hands, praying for its well-being and prosperity and for peace in the world. Help us to be agents of positive change, working together to build a community and world where all are valued, respected, and cared for. Lord, I ask you for your blessing upon our efforts to serve others at Mount Carmel Guild. May our actions be guided by your love and motivated by a genuine desire to make a difference in the lives of those around us. In your name, Lord, we pray for our continued service to the community. May our hands always be your hands, our feet always your feet, and our hearts always be your heart as we seek to serve others in your name through Mount Carmel Guild. Amen.
Amen. Thank you so much, Brenda. At this time, I'm going to be inviting my panel to take their seats. I'm going to be introducing them a little while into the program, but if I'd invite you all to just take a seat. The names are all there. And I wanted to, before we get started in this conversation, I wanted us to kind of create a context, right? Because I touched on some of it earlier, that we are living in a very interesting time, right? You know, the average price of gas right now is what? It's like $5.56 per gallon, right? I mean, how many of you have come here today, you know, having to, what's that?
I said almost $5.
Of almost $5, right? Over $5, right? So that's not only the issue, but there are other issues within the broader economy. And you know what it means is that the supply chain is being affected in a dramatic way. It means that the price of food becomes even more expensive. You know, I meet with persons who come by the food pantry every day, and many of them are having to make decisions, many of them in your organizations as well, as to whether they're going to be purchasing supplies for their home as opposed to purchasing medication, as opposed to making decisions surrounding the purchase of gas or utilities. These are some decisions that persons have to make on an ongoing basis that many of us may take for granted. And so, given all of what is happening within that context, how do we position ourselves as organizations that are mandated to serve, to support, to not just be an organization that provides food, but that in understanding that there are other related issues surrounding those concerns that many persons have, that we are addressing those. Questions of poverty, questions of inequality, questions of different types of issues that affect them on a systemic level. So that we are helping persons to move from just receiving items that they get at a food shelter or at a food program to being able to stand on their own 2 feet. And so this discussion today, navigating change, advancing food insecurity, is really going to help us to examine some of those broader issues and to see to what extent we are preparing ourselves for what is to come, but also what it is that exists in this current dispensation, so that we can be most effective. So let's get straight into it. I'm going to introduce my panel. All right. Okay. All right. All right. So you can give that to Michael. So Michael Packer is on my end. Thank you so much, Brenda.
But okay.
All right. So in front of me is a very esteemed panel. I mean, I met some of these individuals seated here today at various events that I would have attended. Many of them have years of experience in their various fields. They understand food insecurity. They understand many of the issues that are affecting people who are vulnerable in our community. And they understand also that there are related issues, such as health, that becomes a critical question in how it is that we affect or how it is that we address food insecurity. And earlier I touched on the question of poverty and whether it is that we are looking at those root causes of hunger. There is a book by Katie Martin called it's Katie Martin's food pantries and food banks. It's having to do with food pantries and food banks and how it is that food pantries and food banks are addressing food insecurity. And one of the things that she says in it is that it takes more than food to end hunger. And that for a long time, people have been throwing food at hunger, not realizing that there are related issues, there are other issues that we have to be paying close attention to. So I want to open this discussion, first of all, by asking, and I'm going to be asking each of my panelists in just like 2 minutes, you can give me a sense of what it is that food insecurity is, and more broadly, what is food insufficiency? And if you can tie that within the context of what are some of the things that organizations today should be doing to address that issue in just 2 minutes as a quick open, and I'll start with Elizabeth. Elizabeth is, as a quick introduction, the CEO of the Community Food Bank of New Jersey. And the Community Food Bank of New Jersey is the largest anti-hunger and anti-poverty organization in New Jersey. And notice the distinction, anti-hunger and anti-poverty. I'm very happy to see that the two are being looked at very closely. So, Elizabeth, what's your view on this food insecurity question?
Yeah, well, first, thanks for having me, and this is such an important topic. I'm so glad we're talking about it today. We really view food insecurity as when people do not have consistent access to healthy, nutritious, culturally relevant food on an ongoing basis. So it's not hunger, right? We've all felt hunger. That's a very different thing. So this is really people who do not, on a regular basis, know where their next meal is coming from or can't get the right kind of nutrition for themselves and their families.
Excellent. And Joan Healy. Joan is, she's a respected nutrition leader and registered dietitian whose work has focused on empowering families through nutrition education, SNAP outreach, and community wellness initiatives. And just as a quick backdrop, we would have met at Mount Carmel Guild through a program that Joan was in charge of called NJ SNAPED, because it was so important, and we still feel it's important for persons to be taught about healthy eating and how it is that you can use whatever is available to you to prepare healthy meals. Well, that program was cut. But it doesn't mean that the work to continue educating the population about it should stop. And so, Joan, in your work, right now, Joan is with Women, Infants, and Children. That's a WIC program. I'm interested to know, in your work, how important do you find nutrition for especially some of the patients or care receivers, as we call it at the Guild, that you have? Mothers, maternal health, children in their earliest years, the first 100 days of a child's life are so important, and nutrition becomes relevant. What are some of the things that you're finding on the ground?
Yes, and I also want to extend my gratitude. Darren has been an uncommon leader. We met very early on, and it was very obvious to me that he was not looking at putting Band-Aids on a problem. He was looking at solving root causes. So I thank you, and I thank you all for being here. So for the Women, Infants, and Children program, it's vital nutrition. A little anecdote that when some of us had our own children and we left the hospital, where did we go? We went right home. Do you know how many mothers and babies come from the hospital right to the WIC clinic to get their benefits so that, or either, ideally they're breastfeeding, and if not, they literally need to leave our clinic and go to ShopRite with their benefits to go get the formula. That was stunning to me. And so the nutrition is vital because we know that there can be impaired cognitive development with being food insecure that leads to academic issues, which leads to long-term chronic issues, which builds the cycle of poverty. So it's essential that early nutrition, and I'm very pleased that the WIC program has a pretty prescribed products and a cash value benefit for fruits and vegetables, very focused on nutritious foods, which are essential.
Excellent. And just as a follow-up to that, I know, Cecilia, that in your line of work at Arm in Arm, Cecilia is with Arm in Arm, and I met Cecilia as well at several other organizations that have had functions looking at similar issues. Arm in Arm is a household name. The organization has been doing great work across Trenton and Mercer County and beyond. And our two organizations have very similar focus, It's about caring for the most vulnerable. They, of course, are a larger outfit. Mount Carmel Guild focuses, along with its food security kind of attention, we also have our home health nursing program. But in your work, Cecilia, looking at the broad, kind of audience that you have of individuals needing care, what are some of the issues that you see that are beyond food? Do they have issues having to do with access to transportation? Do they have issues having to do with medication that they have need for, and that compounds the issue of food insecurity for them?
Thank you, Darren. Thank you for having me here. And today, I believe I'm the voice of all those members of the community who are coming to our food pantries, as I always mention, putting their pride into their packets and getting into line, waiting to receive not only nutritious food, but hope. These families, when they make the decision to come in and get in line, are families who, just sharing with you, a father who is currently widowed out, who came 2 years ago and said, please forgive me. I'm here because I just dropped off my wife to receive chemo and my kids. And when I went to work, my boss told me this, too late, don't come. And I decided to come here because I need food. So that's what we are seeing. We are seeing families who do not qualify for food stamps, families who qualify for food stamps, but they are struggling without knowing how to have access to the internet to submit their documentation because they are not computer savvy, because they do may have a smartphone that their children gave it to them for Mother's Day, but now they don't know what to do with a monster. And then conclusion is, what's causing this. Every day we see families trying to pay for their kids' extracurriculums because they do not want their kids after school go to be in the screen because they have to work. So in order for them to save money, to make sure they provide hope to their kids, they wanted to provide a better future for their kids, they make the decision to come to our food pantries to receive food. And then is when I say, just visualize what is for each of us when we have to get our pride, put in our pocket, kind of breathe and say, I'm gonna ask for this extra doses of humility and go to the food pantries and get food, because if I don't do that, the consequences are gonna be, my kids are gonna be hungry, or I'm gonna have only enough money to go to the dollar store and just get canned food, maybe one soup or maybe one spoon of peanut butter for each of my kids. When I go to the food pantries in the area, and speaking personally for Arm and Arm, when they have to make the decision between giving a bag of chips or giving a banana or an apple, they see that step of humility is worth it, because they are going to be able to provide a great teaching to their children.
Well, Michael, let's turn to you, and as a sort of follow-up again on what Cecilia was saying, because just as a background as well, Michael, he brings an important healthcare and population health perspective to today's discussion. He's with United Healthcare. He has extensive experience advancing health equity and addressing the social determinants that often shape a person's quality of life. And Cecilia touched on issues having to do with choice, right? Persons having to make some of these choices, but also being so excited to have something that, again, many of us take for granted. Michael, what happens if it is that individuals consistently do not have access to healthy food? What are the health outcomes that persons can look forward to? And I say look forward to in a way that understands that, listen, it's nothing nice that they should be looking forward to.
Sure.
But if this is consistent, what happens?
Well, I only have 2 minutes, so I'll do my best. Thank you so much for having me here. And these esteemed colleagues definitely brought up a lot of the things that came to mind when Darren asked the first question about cultural appropriateness and all that. But as far as health outcomes, and that's really my focus, is really diving into looking at the different aspects of our very, very diverse population in the state. So much that we're one of the most diverse populations in the state of New Jersey. Darren, to your question, obviously health outcomes start at a very, very young age. We touched upon that right from birth. Looking at nutrition of children and the long-term effects of what could possibly happen. We are at a nationwide crisis of childhood obesity. Dental issues. New Jersey looks at their children dental very seriously from a Medicaid standpoint, because these issues at the youngest of ages can lead to chronic obesity, heart problems. We've recently learned as a nation, colon cancer is now the #1 mortality rate for males under 50. So when as an organization, we've really started to dive into these community factors that Darren has invited us here today, because we know there are root causes, and we understand that it's not a one-size-fits-all for any individual on the plan. So when we look at the data and when we start to dive in and dissect and start to look at trends of where we can start, that's a big focus and a big mission for us in 2026 and going forward, is really looking at the community as a whole, and how we can help look at these social determinants of health, and identify where we can be most active and most effective in helping our members and the community as a whole, because a healthier New Jersey leads to healthier outcomes for everybody.
Absolutely, go
please.
right ahead.
I'm not sure if anyone's heard this statistic. The Robert Wood Johnson Foundation had done this study, and I know it's just coincidental, but the distance between the Trenton train station and the Princeton train station, I want to say it's between 12 and 15 miles. And the difference in the life expectancy of someone in Trenton versus someone in Princeton is about that same divide. And in terms of social determinants of health, that you've all heard this, that your zip code is actually more important than your genetic code, given the issues that exist in these certain communities.
Elizabeth?
I just wanted to add, I mean, the physical impact is obviously huge for children, but also the mental health impact. More and more research is looking at even short periods of food insecurity in childhood is something that increases the mental health struggles that people have throughout their lifetime. So just think of the stress and anxiety in a household that is going through that. We're seeing more and more that it really does have a lasting impact.
You know, I had a very interesting discussion recently with a gentleman, and I believe he's in the room. Manatee, are you here? There he is. And one of the things, Manatee, by the way, has been working for many, many years in Trenton, supporting various social development efforts. And one of the things he brought to my attention was that, you know, there's an issue that I think that we've been skirting over for a long time in Trenton, and that has to do with gang violence and gangs, okay? There are a lot of persons who have this impression of Trenton that it is just a violent place and a place to avoid. Much of that has changed. That is the reality. But there are still pockets of it that we have to confront. And something that was so interesting he said to me is that in some areas, persons are even afraid to leave the area to get assistance in other areas because of a sort of enclave mentality, that they should not venture into that area. So even if they're there and are needing support, they're not willing to go. So even as we're having this conversation about addressing food insecurity, as practitioners in the field, but also as donors, as supporters, I'd like for us to also start thinking about how it is that we can, in speaking to our representatives, be more vocal about some of these issues that are presenting a challenge for us to really make a breakthrough where this question of food insecurity is concerned. And Elizabeth, if you could just pick up on the point you were making earlier about mental health and so on, to talk to us now about some of the challenges that you may be seeing in your field that are preventing organizations such as ours, a Mount Carmel Guild, that's a food pantry, or an Arm in Arm, from being able to really make a dent. Is it a question of access? Is it enough food? Is it the wraparound services? What are some of the things you're seeing?
Yeah, all of the above. But one piece, I mean, I think the gang activity is an important point why people might be afraid to go, but also the ICE activity. We've seen a lot of people who are now really afraid to go to pantries because if you're outside waiting in line, they're just feeling too vulnerable. And I think wherever people fall on the political spectrum is kind of irrelevant. Like nobody thinks people should go hungry regardless. And I think we are seeing more and more people who used to come to pantries regularly that stopped. So we've actually been doing emergency boxes. We have food lockers where people can order food ahead of time, have it put in a refrigerated locker so that they can come anytime, so they're not feeling as vulnerable kind of out there standing in a line. So I think the food delivery, we just have to get more creative about. Obviously, coming to a pantry where you're going to be met with other human beings and have that sort of hope that you're getting is so important when possible. But I do think we also have to meet people where they are. But the wraparound services is huge because we have one pantry in Union County that does a very good job of tracking their data. And they happen to, there's sort of a pocket in a wealthy town, but with a number of large immigrant population. It is, sort of people living in public housing. And so what they've found, so they have a lot of resources because they do fundraising in their town, but if they can get someone to come in and meet with somebody, so not just take food and leave, within about 4 months, 50% of those people will not be coming to the pantry anymore, which is pretty amazing because they're saying to them, what brought you here? What are the other issues in your life? How can we help connect you to other services? Maybe it's they were eligible for SNAP and didn't know it, or WIC. So really, it's so important to have that human component. And it's great if it can be paid staff, but volunteers can do that kind of work also.
Yeah. And, and Cecilia, I want to ask you, at Arm in Arm, what are some of the challenges that you are seeing with connecting food resources to other resources that individuals who come for help may need. So for instance, do people come to your organization for food, but you observe that they may also need health and wellness assistance or workforce development assistance? What are some of the things that Arm in Arm could do, or what would you recommend organizations like ourselves do more of insofar as that is concerned?
Arm in Arm, I consider Arm in Arm a hub. When the families come to us, we are open to listen to them first. I believe it's important to be open to listen to these families, because that's what they sometimes come looking for, an answer on how I'm going to pay my rent. Because now I'm hungry, I need to eat. All of us, we have experienced hunger. And you know, when we are hungry, we need to eat if we want to continue thinking. The difference between us and them is that we eat and we can make good choices. That's the hope. With them, the hunger, the experience to, or the access to non-nutritious food, to make those poor choices because I don't have enough money, it brings several consequences. And there is a connection, right? I'm coming to get food because hopefully I can make enough to save to pay my rent because I'm already behind. Or I have to get this stuff for my son. I have to get a toothbrush and a toothpaste for sensitive gums for my son, but I don't have dental insurance. I cannot afford dental insurance. I cannot pay for dental insurance. But now I need to go, and I don't know how to do it. And if I go and apply for, there are places like Henry J. Austin where you have to go, and these families, just to mention, I'm sharing with you what I hear from our community members. I'm a mother of 3 kids. My son has a cavity. I don't have dental insurance. I cannot afford. I know I can apply, but I don't qualify. I don't know which other documents they are asking me. I have submitted many documents, and just still I cannot qualify. So when they come to Arm in Arm, it's very important for us to kind of have our coordinators become a navigator, because we make sure to connect this family with different resources. We invite other partners. United Health was at Arm in Arm, for example. We make sure to invite other partners to come and join us, because we believe the families that they are coming to us, they are not only coming with one need, but several of those. And I feel privileged because we are the ones who are listening to these families, but also responsible, because now we need to have to know how to connect these families with these other resources.
Yep. It's important for us to listen to our care receivers. You know, at Mount Carmel Guild, one of the things that we've been doing is conducting what we call listening sessions. So we're talking to our care receivers and we're asking them, where do you want to go in your personal and professional development? And some of them are saying that they want to get into urban farming. Some of them are saying that they want to do masonry. We can't do that. We don't have the capacity for that, but we certainly know persons who could assist. And so even though we're a very small outfit, we are in the business of gathering that information and sharing it with others. And so I'm saying that because I want to get from my panel a sense of, where do you think food pantries, food banks, and other organizations, whether it be a local church or a community center, where should they now start looking? Because many of the organizations that we run and that are part of, they were established as an emergency response to food. They were not intended to be a mainstay. They were not intended to be a source for day-to-day supplies of food. But it has evolved, hasn't it? It has now become a primary resource for many individuals. But it's more than the food that is required. As I say, you can't throw food at hunger. In 2018, some 4.6 billion pounds of food was distributed across large organizations such as Community Food Bank of New Jersey and the other larger organizations that operate under Feeding America. And still, the problem of hunger persists. Why is that? It means that there are issues that are confronting individuals who come to us for support that we perhaps need to give more attention to. So food pantries and food banks have to now start evolving. And I wondered, Elizabeth, what recommendations would you like to make, to organizations such as ours? Because, if you were to give the audience a sense of the structure, the food banks, the food pantries, and what are some recommendations you would have for us, especially given what's happening now and the needs that we're seeing?
Yeah, a lot of the services that we have or that we support throughout our pantry networks are kind of those extra things that are not just food. Because of course the food is important for today, but the longer term solutions. Some are actually sort of very basic things that we don't even think of. Like, who thinks in the year 2026 that women are still missing work and girls are missing school because they don't have hygiene products, they don't have period products. Giving out those supplies is huge. Diapers. You can't bring your child to daycare if you don't have, X number of diapers. They will not accept the child that day. And those are expensive, and they can't be bought with SNAP. So those are things that we found are just incredibly valuable. So we have a volunteer group actually called Women Fighting Hunger that does a huge period product drive and does a huge diaper drive. Those for pantries are incredible because that is things that are economic stability. You wouldn't think of a diaper as economic stability, but it actually is. Knowing knowledge of the workforce development programs that are out there, because there are so many, but really matching people to something that's going to make sense for them and that is going to bring them to a new level of economic stability. We run two internally at the food bank. One's a culinary food training program and one's a warehouse logistics program, so learning how to use pallet jacks and forklifts and that kind of thing. And we, not entirely, but mostly it's kind of a second chance program, so a large percentage of the people there have had some prison time and so have more trouble getting hired if they don't have some kind of certification especially. So it's really trying to get people to that next level. Because there too, we know recidivism happens when people can't find jobs. It is the number one determinant if somebody's going to be back in prison at some point. So I think workforce development, access to benefits, and people just don't know that they're eligible for WIC or SNAP. And teaching them how to stay eligible. You mentioned the computer skills are huge for that. Like the new HR1 that was passed last summer, the new SNAP regulations, the amount of work requirement documentation that is required, like any one of us would have trouble keeping up with it. And we're asking people to do that who already have stressful lives, probably children, working other jobs, and yet they have to remember to put in those hours and make sure that every single week. And if they miss for like a 3-month period, if they're not, they don't stay compliant, they can't even apply again for 3 years. 3 years by making mistakes in your paperwork. Because 80% of people on SNAP have a working adult in the household. So I think that's one of the things too, is dispelling some of the myths out there is very important. That this is not people sitting home on the couch waiting for a handout. And so I think just the more that you can have knowledge of the benefits out there and the training programs out there or academic programs are really going to help people be able to advance to that point where they don't have to come to the pantry.
So I just want to build on what Elizabeth said. I was so inspired when you were first named and that you looked at the workforce development and those aspects, the root cause issues, as central. So that's great. I also just want a little ray of hope in New Jersey that we have this SNAP Navigator program where people are able to have someone help them, apply, because I think that's one of the largest barriers. But more broadly to your question, with respect to, kind of the networking. So I happen to also co-facilitate a group of the Trenton Health team with Matthew Broad, my co-facilitator, called the Mercer County Food Stakeholders Group. And it's a very cross-sector group, so we have people from academia, government, faith-based organizations, the food pantries. We're so fortunate to have our own food bank in New Jersey. Farmers. And together, I just marvel. We have monthly meetings, and that this cross-sector collaboration and the ability for us to find synergistic answers that bring us, farther, faster. I'll give you one little anecdote. Last year, WIC was given $150,000 in farmers market nutrition program benefits, and only 23% of it got out there because, there's some problems with, various farmers, even applying to be a WIC vendor and whatnot. But how can we facilitate that? That's over $100,000 that were left on the table, and that our farmers could have benefited from. So being a former Rutgers person, I have these connections, and hopefully next year we'll get to a place where we can, that's money on the table. We all can't stand that.
Absolutely. We've been talking a little bit about issues such as persons being incarcerated, issues of recidivism, and so on. And I wondered whether there is a role that we also have to play insofar as youth development is concerned. At my organization, we have a number of individuals who've been supporting the Guild for years. They are the champions upon whose back we stand. They've been with us. But we also recognize the need for injecting youth in the work that we do for sustainability. There are persons who come to the organization sometimes, they just need some hours because of school. But we thought that, rather than you're just doing this because you need hours for school, what are you learning? So what service learning are we incorporating into the experience that you are getting whilst it is that you are there, so that you can become the next generation of persons who does this important work? Michael, do you want to touch on something having to do with that? What role do you see youth playing in the very work that we're doing today, and how can we help to prepare them?
Sure. Well,
I know you're focusing on the health, but listen, this is a conversation we all need to be thinking about as well. I know.
Sure. The youth is the future of our generation.
Absolutely.
Right? So we all know that. I was once youthful. But thank you. So yeah, I mean, we are, as a group, not as a group, as members of New Jersey, as residents of New Jersey, I think that there's an important commitment to the next generation, right? And I think everyone's kind of touched on it without saying it. All starts with education, and it all starts with making sure not only do they have the resources and the food and the housing and everything they need, but that they understand what is in their future based on what they do now and how they act now, right? Yeah. Everyone, when we were in our teens, everyone remembers those times. You didn't really totally understand the consequences of your actions, and people like me at 40 years old would tell you, this is the consequence of your actions. So getting them involved in these community services, getting them in places where they can learn, work-life skills is I think something that our company is focusing on, because these skills do go, math and science, the STEM programs are all great, they're all amazing. But learning how to, as people brought up, learning about hygiene as a female, learning about budgeting as a person.
Where's Brenda? She'll talk about that.
Understanding, that what those life skills are beyond having those core skills that you learn in school, so that when you get to 18, a lot of our members are leaving the house at 18 years old, right? They're not getting a college education. What resources are out there? Skills, trades, not-for-profits, things that they can do to really have a long-lasting, successful life, rather than, so our goal, and I think everyone's goal, should be, to lessen how many people need to take part in these benefits, right? We'd love to see the number go down. Yeah. And how do we do that? Is we start early, we start often, and we really commit to the services and education that they need.
Joan, in our audience, there are a number of donors. There are a number of very committed individuals who've been supporting not just Mount Carmel Guild, but other organizations for many, many years. I want to ensure that they feel that, I know they know it's important work, but if you're doing the same thing over and over and over again, and you may not be feeling that you are needed because things are happening at such a fast pace, persons may begin to feel that, let me look somewhere else because I don't see the impact that I'm making. Can you talk to our audience about the impact that they are making, and that in continuing this important work, what it will mean for our community?
So I think where I come back to is that issue of dignity that you all spoke about, and the human spirit and how alive it is. when I was at SNAP Ed, I thought going to various places, we go to food pantries and whatnot, and do nutrition education. I don't know, I harken back to school when people were throwing spitballs. I'm like, these people don't even know where their next meal is coming from. And yet they are in that hour with me. They are there. And talking about incarceration, if you don't mind me mentioning, there was several groups that formerly incarcerated men. And I'll be honest with you, I had to make sure I could bring a knife into the facility. And can I tell you that these men were the most helpful people of all. They were so in it because they'd been so out of it for so long. A mother who, doesn't know where her next meal is coming from, but is asking specific questions about nutrition to better, her family. And it's this kind of inspiration that we see every day that says that while these systems may still not be figured out, and while the advocacy we need at the national level may not be solved, it is vital, and it is you. It is you who are sustaining, even though sometimes it may feel like Band-Aids. The Band-Aid is needed for the wound to heal in order to move to the next step. So it really is you as the safety net, while the other systemic issues that are worked at more at a policy level and through advocacy is another way. It's vital.
Would you want to touch on that?
Yeah. Well, I wanted to say different topics, but first, merging into the importance of our donors. I'm really grateful with donors because it provides us the flexibility to do more when we receive the support. We are impacting many lives, as I mentioned before. We are the responsibles for what our vulnerable families are going to be doing and sharing with their future, with our youth. Our donors today, I'm going to throw to you, our donors today are the pillars, are the columns that they are holding the food pantries. Because it's not news for all of us, quality of life is very expensive right now. Everything is pricey. You just mentioned gas. I just stopped by the gas station, $70. I almost choked.
Yeah.
But I'm thinking, I'm so privileged because I just still can put gas in my car. What's going to happen to a family who doesn't have that, who doesn't qualify for a SNAP? What's going to happen if tomorrow all the food pantries, they close? What's going to happen to our homeless community if Task close their doors and they don't offer those prepared meals? I see at the food pantries, we were serving last month or 2 months ago, 150 families coming to us. And this last month, it's been 200, 250, 260.
Numbers are going
I can tell our inventory start suffering that friction. And I need to start calling. And when I say I'm referring Arm in Arm needs to start calling our donors. We need your support. We need your support because some families are stopped. They are not receiving any more SNAP benefits because of this. They are not receiving assistance with other things because of this. We, Arm in Arm, have our mobile food pantries. We have 2 brick and mortar, one in Trenton, another one in Princeton. And we do have around 8 mobile food pantries. We learned this after the pandemic. We learned that there were neighborhoods facing food insecurity and the barriers like transportation, the language. We are serving a really diverse community. And as I hear before, no one should suffer hunger, should be suffering food insecurity. And the potencia, United States is the potencia, is the country that everyone seems to be afraid from. So that means we do have something extra to provide to our neighbor in need. And we all know that neighbor who may be struggling. If you hear that this person is struggling with medical bills, that person is struggling without not knowing how to pay for my medical bills, but also how to pay for healthy food. So I want to combine our donors. We are relying, this world is relying on you. Don't feel that your donation is not impacting. And when I speak about donors, it's not only making monetary donations, it's also your time. Probably you are also suffering or experiencing, especially through summer. We need volunteers.
Yep.
And believe me, it's a great therapy because when you come to volunteer and you interact with all this diverse community, you have so much joy, either because I don't understand what they said. They were talking to me, I was talking to them, but I think they didn't understand what I said. I didn't understand what I said, but I had so much fun.
It's just the
right?
interaction.
It's the interaction, the connection, and all that joy. And I see, our donors willing to come back because they have so much fun.
It's a very interesting conversation we're having because, a lot of the times we talk about food insecurity, and sometimes in your minds you may think that it's somebody who's way below the poverty line. Well, that is changing a lot because, of course, with the changes that we're seeing in the economy, it's our next door neighbor, as you mentioned, Cecilia. It's our work colleague. It's someone who is just right next to you. So this question of food insecurity, I think the mask is looking a little different. Yeah, it's changing. The dynamic is changing, and so we have to start preparing our minds for that understanding and looking out for persons who may be experiencing it. And it may just be the person right next to you. It's something that a lot of persons are not prepared to speak about, especially if it is that they've not experienced it for a long time in their lives. It's something that just recently started to happen. So let's also be cognizant of that as we continue this conversation about incorporating the importance of donors, of volunteers in the work that we do. Do you want to touch on that a little bit? Well, actually, I believe it was Elizabeth.
Yeah, we don't unfortunately have volunteers, so.
Okay, so right, Elizabeth, you want to? I'm so sorry, sorry. I keep going.
So our main warehouse is in Hillside. We get about 80,000 volunteer hours a year. It's huge. Like, we could not do what we do without volunteers. I mean, that would be about 40 staff that we'd have to hire. And it is fun, and it's great for teenagers, and it kind of wraps into that, how do youth get involved? And so we always try to do a little education piece, but they're coming, and it's so concrete. Like, if you have a young person, sometimes volunteer jobs, it's hard for them to get their head around. They don't know exactly how they're helping. Here, they are packing boxes, medically tailored meals, or boxes for seniors that they know that, like, the next day someone will be eating that food. And I think that really does make an impact on people when they come and volunteer. So that's a huge part for us. But also the advocacy piece. I mean, last summer, when HR 1 was being debated, like, we had people, I had one congressperson in New Jersey actually called us and said, can you please tell people to stop calling? They all keep calling. And I was like, no, that means we're doing our job. Like, we're going to keep calling. And look, HR 1 still passed a lot of things in it that we were not fond of, but we were able to at least raise the age. They were originally saying that anyone with a child over 6 was going to have these work requirements. Like, how is your 7-year-old staying home alone in the summer? Like, that doesn't even make sense. So at least that age was raised to 14. So still, I don't know that you want your teenager home alone in the summer either, but that's a different problem at least. And so, it did make a difference. And I think sometimes advocacy can be frustrating for people because you can call and call and call and nothing changes. And so we had to sort of point to that as a success and say it's a small success, but it's still out there. And so then engage people, and I think people do really enjoy the volunteer experience. And there's lots of different, some people want to work directly with neighbors. Some people, that makes them nervous, or they're not really comfortable with that. So come to the warehouse, you can do something there, or you can go to a pantry and actually work directly with people. I think it is a very concrete way to be able to help.
And I want to tell you as well that I actually volunteered at the community food bank several months ago. It was on a Saturday. We went there. We did hundreds of boxes. It was so exciting. We got some folks from the Rotary Club, of which I'm a part. And it's just such a fulfilling experience. And that's what we talk about when we speak of collaboration. Because that very food comes to organizations such as ours on the ground, right here in Trenton, across Mercer County. As we close,
Can I just have yeah.
yes, go
So
ahead.
in terms of, you talked about time, talent, and treasure, and I would simply suggest if you could balance that out, because when you give of your time and talent, it's a lot more fulfilling, and you really sort of get to feel the impact of what you're doing. And no deference to Hillside, but if you don't want to travel, we certainly have a lot of organizations here in Mercer County, including our own food bank
Mercer Street Friends.
and Mercer Street Friends. And so maybe Darren would be a conduit for anyone who has any interest in actually going out, and even if it's just once, just to kind of feel it, that would be great.
Thank you so much for
Come
that.
to Armenar. We have multiple volunteer opportunities. I'm not going to miss this opportunity. We are waiting for you. We're going to educate your children, your grandchildren, bring them, have a day together. Believe me, especially teenagers, they are quiet, right? How are you doing? Good. How is the school? Good. But when you start joining a time of volunteering with them, they speak by themselves and you ended up knowing everything.
Yes, yes.
So come in, we have multiple shifts. Let me know at the end of the day, I'm going to be here. We can't wait to have you at Armenar. Believe me, you're not going to regret.
Absolutely. Without neglecting Mount Carmel Guild.
Yeah,
But
no worries.
as we close, I just wanted to hear from the panel, just in under 2 minutes, right? What's one message that you'd like to give to our audience, and what's one action that you would invite them to take? I know you already told them what to do, but let's start.
Okay,
You
I
want to
can
start?
just really quickly,
Okay,
yes.
good.
Why
Message
not,
and
right?
action.
First, thank you so much for taking the time to come here. I do believe time is really expensive.
Yes.
So you having the opportunity to be here is great. And to learn about us, find us on our website, armenarm.org. And believe me, you're not going to regret. We are relying on you for volunteering, for donations, for food drives. Arm and Arm needs you. Arm and Arm is a window for those community members that they can see that there is hope for tomorrow. Help us to continue having that hope alive. Thank you so much.
Thank you so much.
Oh, you can go. Go ahead. Go ahead. What was the question again? There was a lot about.
So there, I need for us all to give the audience just one message that we'd want them to take away and one action that we'd want them to take going out of this discussion.
One message. Okay. I guess the one message I would want, just as an individual, not as a member of a United Healthcare, would be, never stop, giving your time, going to these things, providing your input. It was kind of touched upon. The most you can do is give feedback to our state government, our federal government, our insurance companies. The only way that we can do better is learning from our mistakes, right? So that's my one thing. Or I guess that's a double. That's my message and my goal, my mission for you. But yes, and again, thank you everyone for having me here.
Absolutely.
I think the message I would want to say is just that, this is a hidden problem often. Somebody is food insecure. You may not know that they are, because it's often someone who's doing fine for a while. They're maybe, living paycheck to paycheck, but they've got it together, they're up on their bills, everything, and then someone has a health emergency, or someone's car breakdown, or they get laid off. There is not one community in New Jersey that does not have some food insecurity. People are like, oh, come on, Short Hills, nobody's hungry in Short Hills. Yes, there are people in Short Hills who are food insecure. That this is a problem that really does exist everywhere. College students, 1 in 3 college students in New Jersey is saying that at some point in their college career they are food insecure. That is a huge number. And these are people that are doing what they're supposed to be doing, trying to get to a point where they have a better job, with an education. Mm-hmm. So like college pantries are a great place to, put some resources. But I think just that, spreading the word and letting people understand that and trying not to judge. Like sometimes we'll get people who say like, oh yeah, but they pulled up to the food pantry in their fancy car or whatever. Well, maybe a year ago they were fine and could buy a fancy car. And now if they sell it, it's, we all know how depreciation works, that kind of thing. Like trying not to judge people from what it looks like on the outside, and understanding that this can't happen to everyone, but it can happen to almost everyone. That something really in your life can just go that wrong very quickly.
And Joan?
And my message is one of sincere gratitude, that, Many of you are from the Catholic faith and from other faiths, and even if you're not of faith, I think we can all agree that loving your neighbor as yourself is a core principle. You are doing that as you are here. You are interested in learning more, and you're willing to go out, put some footwork behind that message, and do something. So just with sincere gratitude.
And that's our discussion. Thank you so much, everyone. All right, well, before the panel goes to take their seat, I'm going to be inviting questions, comments from the audience. But of course, I would just want to ask that we keep those comments very brief. We do have another segment to this program, or your questions very brief as well, and our expert panel will be more than happy to answer them, all right? And I saw... You want to do it later? All right, so let me take you first. Just say your name and go right ahead with your question.
My name is Ms. Linda Esau. I represent Eastern Service Workers Association. It's an association that supports the working poor of New Jersey. These people work, but they just can't make enough to make ends meet. My question is to y'all. I see y'all sit here and talk about food, this, food, that, but we have some workers that goes there for food, and they receive food stamps, and some of y'all are saying that, no, they cannot get food because you're getting food stamps. Or either, they're going through changes with this, and then you're asking a life history for somebody that's hungry. I see that we should find a way to make the questions, or when they come for food, much easier than going through a life history just to get food. And it also happens in several organizations right here at the food bank that they're going to. You're asking for life history for somebody that's hungry and in need of food. You know, yes, they get food stamps, but who said food stamps can last this long, as high as the economy is today?
Okay. All right.
One thing I would say is that pantries are, whether you're on food stamps or not, whether you have SNAP or not, you should be able to receive food at a food pantry. So, I mean, that is not something that is something that disqualifies people. I mean, if anyone here has ever tried the SNAP challenge, I highly recommend it if you haven't. It is living on that $6 a day. I did it for 3 days. It is so hard. And it's not hard. You could find something to eat, but like to think about your nutrition and all of that kind of thing. If you have children, like trust me, I did it when my son was away at college because there's no way I could feed my son on $6 a day. But that should not be a disqualifier. So if it is, I mean, that is something to find another pantry or talk to us about, because we do work with the food pantries on that. Okay. In terms of the life history, I mean, it's tricky because you want to sort of engage people. I agree, and our pantries, the model that we recommend is, first time, absolutely, people should have food, no questions asked. It is important to try to engage and understand why people are there if we want to have them be able to get out of the pantry line. So it's a fine line. I totally hear what you're saying, like filling out forms and having to tell you, all the details of my life should not be part of it. And usually we don't even kind of start that detailed intake process until someone's come a few times, because I think then they do have that trust is built and more comfort level. It's hard. We have 800 partners that we work with throughout the state. So can I tell you that every pantry does this right? Probably not. But I think more and more, we're trying to give more technical assistance around that, sort of how to treat people with dignity and respect, how to train volunteers to treat people with dignity and respect. Because everyone does this with a good heart, right? They're trying to help, but sort of walking that fine line of wanting to learn more so that we can help versus somebody feeling like it's intrusive.
Right.
Okay, so I'm sorry. I'm going to, Elizabeth, I'll take that response, but we're going to have to take another question based on the time that we have available. And I saw Manatee first, so you may go ahead, Manatee, with your question.
My name is Manatee Smith, Good morning. My name is Manatee Smith of Producers One Agriculture Group and Sustainable Solution. My question is twofold. One is, how do you see the role of systemic racism in food insecurity, especially in low-income urban areas? And also, how do you see the effect of the Big Beautiful Bill cuts on the urban ag bill? I think it's going to be around $187 billion, and I think 270, they estimating million, is going to affect New Jersey. So what is your perspective on those two questions?
I mean, the racism know that the impact of food insecurity in communities of color is multiples. An African American person in the state is like 4 times more likely to be food insecure. So it's absolutely huge. As someone who has a workforce that is mostly people of color in our warehouse and stuff, I'll try to keep it a quick anecdote, but I think it's important as an employer. My first town hall meeting I did, I'm brand new, I have all these staff there, and I said, ask me anything kind of thing. And someone said, could you give us a list of the pantries that are near here that I could go to after work? And it was like a kick in the gut. Like, here this person works at the food bank, and we were not paying them enough that they couldn't, could not use the pantry system. At that point, I think our lowest paid employee was at about $17. I've been there a little over 2.5 years. You're up to about 24. Like, it is our main priority when we budget, is getting my staff to a higher living wage. I hope more employers try to focus on that. Believe me, I wish we were doing even more than that, because trying to feed your family on $24 an hour still isn't going to be easy. But I think that is the role that as employers that we have, is to try to keep raising wages and keeping things sort of. And then in terms of the bill, it is catastrophic. We saw in November what a pause to SNAP benefits for people for 1 week meant. They're literally miles long. When I pulled up to our first huge food distribution, the line was 2 miles long in cars, and we were not opening for another hour. And this is mostly people who have never been to a food pantry, who are not, in that position. But more and more of those people, this time it won't be a cliff, and I think that's intentional. It's going to be, so they hope people won't notice as much as it happens slowly. But starting this month, people are starting to be removed from the roles because they cannot meet those work requirements. And again, it's not that they're not working often. It's just that it's so difficult to do. So I really think that, we're lucky we're in New Jersey, because New Jersey has put money to try to sustain it. New Jersey kept the $95 minimum for SNAP, which other states did not. We've already heard of 2 states that might just cancel SNAP because they can't handle the state cost share. So I really do think it's catastrophic. I hate to give such a bummer of an answer for a question, but I think it's really, really scary.
Okay, I'm sorry. Go right ahead. Introduce yourself and your question or comment.
My name is Max Gatto. I am with the Trenton Area Soup Kitchen. So while we were here today, my organization and Cecilia's organization, we had our mobile units out at the same time, them distributing the produce and the fresh grocery items, while we were distributing with our nonprofit food truck, hot meals ready to eat. So we've seen great success with that. I know when we first started those co-locations, we partnered with Capital Health, and we started out rotating between 2 different sites, each of us at our own location. And we heard from our patrons that they felt like they had to choose between the 2, and they were either getting the produce that would last them the week, but not the hot meals that they could eat right then and there, or vice versa. So once we saw that, and I heard that from the patrons, we set up that meeting with Arm in Arm and Capital Health, and we're able to be at the same location every week, so that way people could get those items that last them the week, and without having to dive into that right away, they could have the hot meals that they could take home to their families as well. And we've seen great success with that. So I'd say from the co-locations, that's definitely where we're branching out to and finding more ways that we could work together, because a lot of our organizations, while we're checking the same boxes, we're really not stepping on each other's toes, because we all are all trying to do the same thing. So in anyone's opinion, what are the best ways that our organizations can work together and co-locate while still satisfying the needs that we're trying to do as our own individual organizations?
Thank you, Matt. And I'm sorry, we only have time after this response for one more comment question. I'll take it from Brenda as we close. All right.
I can just say that way to go, mobile. The pandemic, there's the silver linings. We all hate the word, but we have a WIC on wheels, and we go out there, and we've got the mobile food pantry. Brilliance at task, turning on a 3rd overnight crew so that they could do hot meal truck. It's crazy good. So I think that what's good, and task is part of our Mercer County Food Stakeholders Group. We're always looking at those opportunities, and you think that all the partnerships are made, and the networking, and the going out together, but they're not all there. And as a new WIC director, I'm seeing so many opportunities. That there's still a fair bit of siloing going on. So this partnership, like I said, is what brings synergistic, bigger, better solutions. And I can't cite a number of specific examples here, but the cross-sector collaboration and networking brings new ideas that it just doesn't happen, on our own.
please join me in giving an absolute round of applause. This has been incredibly, incredibly helpful. I just want to follow up on one thing. To hear that a representative called and said, tell your people to stop calling, was wonderful. Okay? So I want to follow up with that because when you talk about that big, beautiful, which I hate calling it that, so HR, whatever, HR1, I won't tell you what I normally call it. Advocacy is vital. Okay? So if you want to know how you can become a key part of advocacy from your own home, you don't even leave your home. You get on your computer. You can sign up for a variety of what we call action alerts. Our Catholic Charities has an action alert called Voter Voice. New Jersey Catholic Conference has an action alert about all the things that are going on that are impacting the people who are in our own neighborhoods. Okay? So if you want more, I'm going to give a list of sites that you can consider signing up for. Whether or not you do the response is up to you, but you're going to get educated on what this means to the people we work with. So I am thrilled that that was brought into the conversation because we cannot keep just trying to make the Band-Aids better. We've got to address the bigger picture, and advocacy is the way to do it. So thank you so much. It's absolutely been wonderful. Collaboration, in my opinion, is the way to go. And so we're going to keep pushing for that. Thank you so much. Thank you so much.
Thank you so much. Another round of applause for our panel.
That is wonderful.
All right, so we're going to be switching gears a little bit now. We're going to be getting into some program reports. How are we doing at Mount Carmel Guild, right? We're going to be talking about that. And to lead that off, we're going to have our Director of Nursing. Her name is Corinne Janoska, to give her report on the program. But before she comes, I just want you to take a quick look at this.
Rotary International's motto is service above self. The Guild's Aging in Place appeal hit a soft spot in our heart. It just makes so much sense. These dedicated nurses that go and help the seniors, blood pressure checks, medications, etc., and companionship. The Aging in Place program takes care of those that can't afford to have people come in and do for them, and it keeps them healthy enough to stay out of things like nursing homes and hospitals and physical therapy. It's part of compassion to treat our older population as people, not Medicare statistics. It is a remarkably well-run, efficient organization that we're proud to support.
Good morning. It's a pleasure to be here, and I always enjoy talking about the nursing program. For those who aren't familiar with the nursing program, the home health nursing program is available to low-income senior citizens 60 and older living in Mercer County. This free service provided in their home is meant to delay premature placement in nursing homes. And the home care services that we provide are not covered by insurance, and is one of the reasons why the program is so valuable. So typically I will receive a referral, which can come either through the website or a phone call directly to me. And after I receive the referral and determine if the qualifications are met, I'll set up an initial home visit. At that home visit, I will do a physical assessment and a safety assessment, and then determine if their needs are for medication management, injections, monitor blood pressure, or related to diabetic needs. Generally, when we fill the pill boxes, it'll be either weekly, biweekly, or monthly, depending on their need. Not only do we fill it, but we monitor the usage and we refill prescriptions for them so that they are delivered and ready for us at the next visit. I find patients who have dementia find this extremely difficult to manage. So most of our patients do have dementia, and this has been a great help to them. If the patient is diabetic, we'll monitor their blood sugar at each visit, and we can change the glucose monitoring systems because some of them have a difficult time with that. And we also do diabetic teaching. Some of the challenges that I've faced over the years, first one would be non-compliance. So our seniors want to remain independent, and sometimes they don't always acknowledge the need for the service. Frequently, my referrals come from case managers, and they see the need, and the doctor sees the need. However, when I call the patient, they will refuse the service. Another challenge is cognitive impairment. As I mentioned, a lot of our seniors have dementia. And another one is lack of family involvement. So some of our seniors live with family and depend on them to take them to doctor's appointments and to pick up their medication. And I frequently find that family members have so much going on in their own lives that they may neglect taking care of the loved one in their home and not take them to the appointments. And therefore, if they don't go to the appointments, the doctor can't order and refill the medicine, and therefore kind of it stops me from making my scheduled visit. Another issue is neglect. So in the last 2 months, I've had to call Adult Protective Services twice, which I haven't done in a very, very long time. The reason for this was neglect, actually, from 2 family members, not caring for their parent the way they should. It was lack of personal care, poor nutrition. Not that they couldn't afford food, they just didn't have the time to do the meal preparation or get them food. And frequently they aren't washing their clothes and they're not encouraging personal care. So when I called Adult Protective Services and they came out for these 2 visits, it certainly changed the family's perspective, and it got them to do what they really needed to do. So I'm thankful for them because it's really sad to see a senior, with dirty clothes, not been shaven, no personal care, and hungry. So, so that was unfortunately something I had to do twice, which, like I said, I haven't done in a long time. The nursing program is accredited by the National Institute for Home Care Accreditation, which upholds us to a higher standard of practice. And our accreditation review takes place every 3 years. So I just wanted to share some stories with you just so you can get an idea of how it impacts the community. So I received a referral from a case manager for a woman who needs injections, 2 injections twice a week. She has a condition similar to Lou Gehrig's disease, and she's trying a lot of experimental treatments. And this is one of them, but these injections are on certain days and on certain times because she has so many other treatments she's receiving. So I was told by the case manager that they had called several home care agencies, and the home care agencies could not have a nurse to go out twice a week just to give an injection. So they called upon Mount Carmel Guild, and I've been doing now this for over a year, and she is just so grateful As you can imagine, anybody in that situation would want to do anything they could to get whatever treatment for that disease. The other story I wanted to share is I had a daughter reach out to me whose father lives in Trenton. He's 75 years old, and he has a live-in caregiver. And this caregiver was managing the medicine, and he has 25 to 30 medicines he takes, sometimes up to 3 times a day. And so she didn't feel that the caregiver was managing it. So she called on me. She heard about our program. She called on me. And I go out there to fill his pillboxes, and I have to tell you, it takes me at least 45 minutes to do all that medicine, to manage it, to call in the prescriptions, have them delivered at my next visit. And she frequently texts me to give me updates, and I just want to tell you what her recent text to me was. She says, "I give you full credit for his stable and improving health. The consistency of his medication, thanks to your visits, is a big part as to why I believe he is in stable condition. The doctors truly recognize the positive impact as well. We are so, so grateful." So I hope this gives you an idea of how important this program is to our senior citizens in the community. Does anybody have any questions?
What is your caseload?
Currently?
Yeah.
So currently we have 9 patients. I'm the only nurse, and I look after these 9, and we are open to more referrals. So if anybody does know of anybody, you can feel free to just call me directly or go to the website, and there's a form to complete. Yes?
How often can you visit a patient? Like, is it limited or just very weeks?
It's both. So I go out, I can't go out more than once a week. So I do once a week or twice a week, depending on their needs. So I fill the pillboxes as long as I can, just in case I couldn't get back since I'm the only nurse or whatever. But they're always covered with their medicine, whether it's 2 weeks or 3 weeks. And if they, initially when I see somebody, I will go out once a week just to make sure that they are doing their medicine, taking it correctly. And then if I can, I can stretch it to 2 weeks.
That's it. Well, thank you so much again, Corinne. Another round of applause. And you know, it's important for us to also understand that you know, this program, it's more than just the clinical aspect of things that we offer. It's also companionship. Corinne perhaps didn't want to share some of these other stories, but there are just so many of persons who just needed to have someone in their space to talk to have conversations with. And there are a number of elderly folk who do require that kind of care, especially given the fact that they are on their own, they're all alone. So it's an important program. I know that there are individuals who can benefit from this program, and as we continue to scale in numbers, we want to get an additional nurse on board who can assist us to meet that caseload. For a while, we have been hovering anywhere between, she mentioned 9 and 11, sometimes 12 patients. Some persons we would have had to, or they may have gone out of the system because they are gone into another type of care, whether it be palliative care, or they are not meeting the requirements that have been set for them. And these are things that we have to pay attention to ensure that we don't find ourselves in trouble either, right? So it's a very important program. Please make the referrals if you're aware of persons who would need that kind of help. All right, so I'm turning now to our community support program, and we've been talking about this with the panel discussion and what it is that we do at Mount Carmel Guild beyond our nursing program. So our core program is our food pantry. It's an open choice food pantry, and we have been in existence, as we mentioned earlier, since 1920. The organization was formally established, and we've been doing this ever since. Over the years, we have evolved to meet the needs of our care receivers. Individuals are able to come twice per month. They're given a range of items, shelf-stable items. There are also meat products as well that they have access to. A number of the foods that we receive are from the Community Food Bank, that's the Mercer Street Friends Food Bank. But there are also items that we receive from our various parishes. There are a number of parishes across the Diocese of Trenton, and they do a heck of a job at keeping us afloat. I can tell you there are days when we may be down on our inventory, but we can always pick up our phone and say, hey, Catholic, or hey, Ellie, or hey, somebody, we need something, right? And we can rely on them, talk about collaboration, right? But beyond that too, there are private individuals who will just be driving by and they see what is happening and they will come by and they will offer their services. So we have been very grateful over the years to be able to consistently meet the needs of our care receivers without ending. And my predecessor, Mary Incrott, many of you may have met her. You know, during the pandemic, when some other food pantries may have decided to close or were operating on a limited basis, we remained open. Because we recognized that even though that issue was persisting, that of the pandemic, people were still needing food, especially during that time they would still need food. And I think that that is one of the things that really draws a lot of people to Mount Carmel Guild. It's a family setting. It's an environment where we build those relationships with our care receivers and they're able to call, express a concern, and we do our very best to meet those concerns. So I mentioned some of them earlier. Food chosen by each care receiver, it's not prepackaged. All of these they're able to select from shelves so they can make informed decisions about what it is that they want. And one of the things that I'm currently looking into, and perhaps other food pantries can or are looking into it themselves, I would like to develop an app that can give my care receivers a sense of what it is that we have on offer before they show up. Because there are days that they come to the food pantry and it's just one of those days that we just do not have the range of things that they would like, or the range of things that meet their dietary or requirements, right? So I would like to develop something that can see our care receivers getting some insights on because they come twice per month, on what it is that we have so they can move from there. We want it to be more inclusive rather than exclusive. We also do personal care and hygiene products. There are clothing items that we do. There are a number of holiday projects as well, and you'll learn a little bit more about some of those, or Thanksgiving food basket drive, or Christmas toy shop, among others. Some fast facts: we're averaging right now between 1,400 household visits at the pantry per month. That number is trending up slowly but surely, I can tell you that. And we're averaging anywhere between 18 requests for financial assistance per week. We would usually receive financial assistance from various organizations for things such as back rent or utility assistance, but much of that funding has been dramatically cut. And so since the start of this year, we've not been able, unfortunately, to assist where that is concerned, though the requests continue to come. We're continuing to look for other sources because we understand that the need is great. Fortunately, we have a partnership with Catholic Charities, and they have been able to assist insofar as some of these are concerned. And there are other organizations as well that we often refer persons to get that kind of help. Approximately 3 in 5 families at our pantry are Spanish speaking. We do have a bilingual staff on location, so that helps a lot. And the pantry, as I mentioned, we became Open Choice in 2024. I won't spend too much time on this slide because Corinne spoke a lot about the home health nursing program, except to say that we are seeing 561 units of service being given, or we provided for the fiscal year between June and July, 561 units of service, which is up to 45 minutes of individual care for that period. Nurses check for signs of elder abuse. She mentioned food insecurity. And of course, because we're a food pantry, if that exists, there's also the option for persons to gain access to food. We're reaccredited every 3 years by the National Institute for Home Care Accreditation. And though we have some of these listed partners from whom we get referrals, we're always open to yet others. There's RWJ. There's recently the Princeton Housing Authority that we have been in dialogue with, Center for Modern Aging, among others. In July, and I'm just going to go month by month to give you a sense of some of the things that we've been doing. As I mentioned, our fiscal year starts on July 1 and it ends at the 30th of June. During the summer, children are out of school, right? And so it means that whereas they may have had access to food supplies, they do not know as much during that time when they are home. So we have a program called our Summer Feeding Families Program, where we invite especially young people who are out of school who want to assist this kind of program. They're the ones who take the lead. So they assist us with determining what are some of the food items we need to get through surveys that they conduct. So there will be surveys that we prepare. We would share those with our care receivers and we would say, what are some things that you would like over the summer period? We get that information and we go to market. At the end of it, of course, we do a distribution survey. What was the experience like? Was it helpful? What are some of the things that you may have changed? And you can see here Jameson and his sister Campbell Tormey, who are also being honored this year at our annual gala, which you'll hear a little bit more about. So the kids take the lead and they're helping children as well. And so for this year we did a number of items, a range of items that we did. But we also had, for the 4th of July, we did corn, and we also did some ketchup and I believe we did hamburgers, among other things. That was for the month of July. In August, that is when we turn our attention to back to school. So we'd usually do a book bag drive. At the time, there was the NJ Snap Ed that was in operation, where we were providing healthy eating, cooking classes for our care receivers. That again has been cut. But again, we're looking for other opportunities to provide that service consistently. Our Aging in Place appeal is where it is that we reach out to the community to share with them information about how they can support the home health nursing program. So individuals receive a communique in the mail inviting them to donate to the Aging in Place appeal. And then we also had this exciting kind of off-the-cuff Jesus on the Block party where we went out into the streets with a Baptist church. I believe it was Emmanuel Baptist Church, and we had the on the Block party. It was very great for interacting with persons, introducing our programs to them, and so on. We're all about community involvement. But also in the top right, you'll see where I made a visit to Snipes Farms and Education Center. It's just across the bridge, because we wanted to see to what extent we could partner with them for fresh produce. And so we have an existing MOU with Snipes Farm for the provision of fresh produce to our food pantry. But beyond that, we're also looking into Snipes for providing modules of urban farming training for our care receivers at the Gill. And that is something I'm very excited about. And so you'll hear more about that in the months to come. In September, I shared with you that I was at your office, Elizabeth, at the Community Food Bank of New Jersey, where we packaged hundreds of boxes, myself and some others. And so that was exciting for us. We did a cleanup drive at the Guild with some Princeton students you'll see at the top right. They came and they really did a fantastic job at cleaning up the extremities of the organization, assisting us on the insides as well with shelving, packing, boxing, that sort of thing. Continuing the motif of partnerships, we partnered with the Hope Baptist Food Pantry, providing them with items of food for their own food pantry. And we often do that when it is that we have the supplies. We give food items to other food pantries as well. In October, we turn our attention to our annual fundraising gala. It's our largest event for the year. And this year, we really knock it out the park. And I'm so grateful to all the persons who supported this event. We made close to $120,000 that night. Prior years, we would have been hovering, in reasonably similar models or similar ranges, but this year was really, really exciting for us because our numbers were significantly more in terms of turnout, and we were able to get quite a number of sponsors. And that, again, was so exciting. So you'll hear more about it, and if you're interested, feel free to come as well. It's held every year in October, and this year it'll be held on the 16th, right? Yeah, on the 16th. In November, we had our Thanksgiving food drive where we distributed 1,404 bags of whole turkeys along with the various trappings to prepare a Thanksgiving meal. We got some support from an Amazon delivery partner because during that time, a number of persons were expressing concern about coming physically to the guild because of issues surrounding ICE, but also there were a number of persons who were homebound. And so we met up with a gentleman, again, an Amazon delivery partner, and he was happy to come by, and he provided us access to his trucks, and we were able to go house to house, dropping off these bags of turkeys. That was just something. That was just out of the ordinary, and we were so blessed to have that. But beyond that, too, we were able to also have some of these deliveries be made to other organizations. We're talking about interfaith caregivers. I believe there were CYO, and others who wanted to do similar distributions. So at-home distributions, but also to individuals as well. Partnerships are so important for us. In the top right, that's a family who benefited from the Thanksgiving food drive. One of the things we do is we invite persons, only if they want to send us a picture of them at their Thanksgiving table, and we give them a gift card in return for that. Some additional funds that they can take to ShopRite to get some additional food items. So that's a beautiful family right there. And then in December, we had for the second time our benefit concert with Father Alphonse and the orchestra of St. Peter by the Sea. It started in 2025 for the first time. That was exciting for us. Again, fundraising. And we did it again we did it in 24 and we did it again in 2025. And then beyond that too, we had our Christmas celebration with care receivers where we transformed one of our boardrooms at the property into a toy shop. So you can see a number of the items that were donated. There are everything from stuffed animals to puzzles to entire bikes, whole bikes, to doll houses. And persons are able to come and they get an entire bag filled with Christmas items to take home to their children. And as always, we often give to other organizations as well. And we were also able to do some of that for the what was it again? It's the Trenton Police Station, the Community Services Unit of the Trenton Police Station. They also got some of those because they too have a Christmas toy drive or distribution that they do around that time as well. In January, we had our winter coat drive or Martin Luther King Jr. Day of Service, where we had staff members from City Hall who came by to volunteer at the Guild. We had a courtesy visit by the Rotary Club of Trenton, and we had a National Puzzle Day distribution. Valentine's Day, we turn our attention to chocolates. We give persons chocolates. That's okay to have a little bit of sweet every now and then, even though we're talking about healthy eating. And, warm socks as well. So that was a nice little touch for us in February. Then in March, we have our annual Founders Day Mass. And we met also with some students from Notre Dame High School who came for a day of service. And they assisted us with, again, a range of items, packing shelves, assisting care receivers, and service learning, because we always emphasize the importance of service learning. What have you learned as a result of being here today? Do you know the impact that you're having on the community by virtue of your volunteerism? In April, we did our Easter basket distribution. We had our new clothing distribution day, which, by the way, is on Wednesdays. So from 10 a.m. through to 1 p.m. on Wednesdays, we do clothing, just clothing items, and then we transition into food. We have the shelves set up for persons to get a range of those items, and we do have a lot of clothing that we're trying to offload. And you can see us there with the Community Affairs Unit of the Trenton Police, who we also gave some Easter baskets to for their own drive. In May, we had our Cinco de Mayo distribution where we did avocados and onions. As always, we try to remind persons about the importance of healthy produce. So there were little notes that went with it as well about the value of avocados and the value of onions and so on that went on in May. Just some quick updates. Moving forward, we're going to be having our total agency review in June. Our annual meeting of the Professional Advisory Committee follows thereafter. And then we also have our strategic plan update. And I saw Patty here earlier. I believe she left. But we're going to be meeting with our board and various committee members to really review our strategic plan. Ask ourselves the question, what are some of the things that we had set out to do? What have we achieved? And what do we want to achieve going forward? So those are just some in-house plans that we have for the next 2 months. For 2026, these are a number of our honorees. It includes Joy Wright, Brenda Rasher, who was here earlier, Kathy Moore, the Community Garden Ministry at St. Gregory the Great Parish, John Hartnett, gentleman who assisted us with the distribution of Thanksgiving meal baskets through his Amazon delivery partnership, Kylie Hilson, Jameson, and Campbell Tormey. So they will be honored at our gala. They'll be recognized for their support that they've been giving to the Guild for many, many years, and it'll be a great celebration. It always is such a fantastic time for persons to meet, greet, interact, and to come on board in support of the Guild. So, I know I rushed through that, right? But it's been a long day and we don't want to keep you here too much longer. We have some time for interaction, but I wanted to ask you, you know, we've been talking a lot about food insecurity. We've been talking a lot about some of the work that you do. Some of you may not be aligned with specific organizations. Some of you may not be aligned with Mount Carmel Guild at all. But if you are interested in becoming a member of Mount Carmel Guild, and that means supporting us on an ongoing basis, whether it be in your time or your talent or your treasure, what inspired you, for those of you who are mission members, to become a mission member of the Guild? And for those of you who are not mission members, do you see yourself supporting an organization such as ours? And if so, how could you do that? Before you answer that, though, I want you to hear from one of our mission members.
Hi, I'm Carol Moore, and I am a mission member here at the Mount Carmel Guild. I really believe in the mission here at the Guild, helping those who need food, the working poor, people that just don't have enough money to buy all of the groceries that they need for their families. And I also really value the home nursing program where elderly are able to stay at home and the nursing staff goes and visits them regularly to see if they're okay. My own life, I have had some challenges in my life, and I know what that feels like to have those challenges. It makes me appreciate even more the work that's done here, that these people come here and can get the help that they need. So we are called to help others. And I'm challenging you. Can you think of ways that you can help the Mount Carmel Guild? Maybe you can help somewhere administratively, or maybe you can help right here at the pantry, or maybe you can help with the home nursing program. But there's some way, some big thing or some little thing you can do to help the Mount Carmel Guild.
All right, Dan, I'm going to put you on the spot. I'm sorry. You're in my head right now, and I'm just going to ask you. Dan has been with us. Dan has been with Mount Carmel Guild for much longer than I've been at the Guild, supporting us as a volunteer in the food pantry. He does intakes, he processes persons as they go through, and he's just a nice guy. He's just a wonderful, wonderful guy. What inspired you, Dan, to become a mission member of Mount Carmel Guild?
It's Catholic. It's a ministry of service. It's very welcoming, very respectful, and extremely non-judgmental. As I retired, I wanted to need to have something. And to be able to be with people who don't have the blessings and the wherewithal that many of us do. Was I thought, now nobody's ever said I need a microphone. When I used to work, they used to take the microphone away. But it provides an opportunity to be with people, good people who need help, but for the grace of God. And when I drove back from the Guild yesterday, Cecilia, and I loved when you had those names up there. Unfortunately, I should have gone to the eye doctor sooner. I have it on my list. And I know we have Cecilia and Joan and Elizabeth and Mike. See, it's not totally gone. But when I was driving back from the Guild yesterday, I drove by the Mercertown Library, and Arm was there, not with one truck, but with two. And I was thinking to myself, a food pantry can't be now what it was 10. It just can't be the best you can be unless you do more than provide food. What I've seen over the years is not so much WIC. Before the pandemic, many of our care receivers, a significant number, had WIC, SSI. I hardly ever see WIC or SSI. See way less food stamps, way less. And there are reasons for that. One of them is our demographic is remarkably changed. We're Latino Hispanic. It's at 3 out of 5, I think it's more than that. Latino Hispanic. I know ICE has to do with that. But the need to collaborate, the need to provide what I'm going to push for, I haven't told you yet. But what I'd like to see us give more money for is I'd like to give us more money so we can get more staff. Our volunteers are great. Darren, I almost had to object because there at the beginning I thought you were saying we're too old.
No.
Many of us are. Believe me, many of us are. But what I really want to do, we have a woman who comes from United Way, I think a couple times, and she sits next to me where I do the intake. And I watch her fill out the SNAP. These are, yes, it is hard. It's hard. And if you can actually do it, if you can sit them down and do it, I don't know what documentation you need. Apparently it's too much. But if you can actually help them on the spot, it'll get done. And I don't know if Arm & Arm does that, but boy, on Monday afternoon, you have a lot of people there. You have a lot of people that are helping, and you have a lot of people receiving care. And it's a wonderful thing to say. Was that too long?
You're fine, but thank you so much. He's always very insightful, and I appreciate that. Thanks, Dan. And it's the passion that I think that is one of the things that really keeps us going, because we do have very passionate people who are part of our makeup, and we need that. We need that in the work that we do. I wanna also mention, because you had mentioned Arm & Arm and the wonderful work that you do. By the way, we were there a few weeks ago, myself and Abby, for the Mercer County Library System service that you provide. So they'd normally have a truck at the Mercer County Library System providing food, and persons would be able to go and speak about their programs. And we were there, and it was a very exciting experience for us. But new that I want to share with you of something that's coming up with Mount Carmel Guild is that we got a grant recently of close to $500,000 through the NJ Feed program. Are you familiar with it? It's through a partnership that we established with Catholic Charities. And so this grant is something I'm very excited about because it's going to mean that we're going to be able to do more than provide the food that we currently do at our food pantry. We're identifying 6 food deserts across Mercer County, and we're going to be taking on a staff member who will be delivering food to these sort of food deserts, whether they be churches or they be community centers, and having those food be dropped off on an ongoing basis so that we are widening the network of care that we're providing. Beyond that too, there are other things I mentioned. The app, that is something that's going to be coming on board. But there are other elements as well that I'm so excited about. You'll be hearing more about it. But the most fundamental thing is that we're going to be addressing food insecurity beyond just the confines of Mount Carmel Guild. So we'll be able to go beyond that. So you can look forward to that. You'll hear more about it in the coming months. And so as I close, are there any unmet needs you believe Mount Carmel Guild and other organizations such as ourselves should be addressing at this time? I mean, I know we spoke about some of them before, but is there anything else that you think where specific needs are concerned that perhaps we're not addressing that we should be looking at? All right, so we're doing everything. We're doing everything. We're doing everything we can. You know, we really do our best. We really do our best. And so I won't spend too much time on this. I mean, fundraising is always very critical. Fundraising initiatives are important, and I think, you know, we are very creative in this space. We do our best. We're always open to recommendations, suggestions that you may have for that. But we wanted to hear from you, from your own perspectives, about some of the things that you are doing. And I think we have had much of that shared by our excellent panel this morning. Give them another round of applause for me. And so, we did a lot of question and answers. But are there any other questions that anyone may have? Any comments that you'd like to leave? Any final comments that you'd like to share? Some of us were very quiet today. Not you. You know, but we took notes, and that's good. Any questions?
I know you're against the clock. One thing I've always thought of, you know, being a parishioner, you know, the food drives come and people do this disconnected, you know, kind of giving. Makes them feel good. It's great. We love it. But I'm trying to figure out, I'm a former marketing person, how do we connect people? I don't like the word, you know, the former like adopt a family type thing. I know that if people in the pews really knew the lives of people and were able to connect in some way through Mount Carmel Guild to giving or sponsoring or whatever the words are, they cannot be diminutive. It has to be with dignity. But I really feel, until I entered into this world, I had no idea that 15 miles down the road, all this was happening. I had no idea. I didn't know the full context. So I can speak with you outside of this because I know we're running against the clock. Right. But I really think that there needs to be a way for this to be less of, like, I dropped something off in a box, I'm at a parent. I want something that connects people. You know, Community Food Bank has done a great job of using the word neighbors, right? Yeah. There's a mentality shift. And that connection is what will breed the deeper commitment, which will lead to the greater, you know, benefit of people.
You're building affinity with the organization.
Yes, exactly. Not just the organization.
With the mission.
With the mission and the
human
needs.
needs.
Yes.
Excellent. Yes. Thanks for that. That's important for us as well. Yes, go ahead.
I just have a comment.
Sure.
My name is Luisa, and I'm a social service department at Princeton Community Housing and have Human Society.
We spoke.
We got this invitation. We didn't know what to expect, and I'm so glad that we attended. I think it shows how connection is so important. We don't arm in arm firsthand, and I think that continue creating these connections is what really is going to get us to the world. So thank you so much for coming.
Absolutely. Thank you so very much for coming. Thank you. We'll be talking.
I know we need to end, but I'd like to give you a challenge. When you see a problem,
I don't want you to say, we can't do that. Okay? I want you all to start saying, how can we do that? Because once you ask, how can we do that, you have opened the door for ideas to flow. And sometimes the best, craziest ideas actually turn out to be something that works. So wherever you are, don't approach any problem as, oh my God, we can't do that. Well, maybe you individually can, but you can enable an organization that's begun to do that to do it more. So that's my challenge for you. I invite you to support the Guild. As the Bishop's delegate, I'm not required to support the Guild financially, but I do. Okay? I feel called to do my share, and the Guild is one of those organizations that I'm very passionate that we need to help grow, because to make the communities better, we need to be better.
Thank you so much. Thank you. Another round of applause for everyone. We'll be sending out a survey. You'll get it in your emails about today's event. Feel free to share your comments. Some of you may not have spoken. There may be other kind of perspectives that you'd want to share. We'll be welcoming that as well. I mentioned some up next, or gala, which will be the 31st annual gala to be held on the 16th of October. You'll be hearing more about it, and we'd welcome you to join us. And we'll be having a public webinar on our home health nursing program on the 11th of June to have persons know more. So if there are individuals in your community who you believe could benefit from it, or who could be referral entities, it's your church, it's your community center, it's your school, whatever it is, we'll invite them to be a part of it so they can learn more and sign up on the spot.